As we are wrapping up today's research updates, we do have a bonus session this afternoon that's going to be sharing more information about the valuable resources and some practical tips for caregivers during this current pandemic. So I'm going to turn it over for our next presenter to be introduced.
I'm happy to introduce Denise Gibson, volunteer program facilitator for the Alzheimer's Association. Denise has volunteered with the association for several years as a community educator. In her current work, she is a senior care and dementia professional dedicated to raising greater awareness of residents' quality of life. She passionately believes that educating caregivers and professionals and the community is imperative to successfully create a meaningful life for a person with dementia. In her personal life, Denise traveled the world with her husband, who played professional soccer, before settling down and having 3 sons. Denise, you have the floor.
Thank you so much. It's great to be here. I work in a community right now, so this past year has been extremely stressful for the nursing home and assisted living communities. And I've been able to work with the Alzheimer's Association, kind of getting the word out to our community care partners as well on how to manage and navigate this. It's unprecedented for all of us. So my role, this past year has gone from engaging residents who are in a quarantine situation, engaging residents who are in isolation, maybe they're sick on their own. We were lucky enough to have a COVID unit on our campus, so I did consulting in there because a lot of our memory care residents ended up getting sick from other sister communities too. So in order to mitigate the exposure, we were able to isolate them and bring them into a certain area of the campus. So some of them were very sick, some of them were asymptomatic, but the whole, the break of routine, the families not being able to come in weighed very heavily on us. The people at home who are caring for their loved ones, their change in routine, things like that is what we're going to kind of go over today as well. So we'll go ahead and start. If you go to the next slide. So we're going to talk about COVID-19 and dementia, tips for caregivers, and Alzheimer's Association resources that are going to be very, very important. So COVID-19 and dementia, most likely dementia does not increase the risk, but they are finding now that it is. A lot of the underlying conditions we see, like diabetes, heart disease, obesity, things like that, give you a higher risk of COVID-19, but they also give you a higher risk of dementia. So we're seeing a lot of that. They are doing some research in this area. Obviously, it's still ongoing because the more we uncover about COVID-19 in the brain, the more we'll understand and know what's going on. But they are looking very closely at that and how to kind of combat some of that. We know when people get infections, their cognitive impairment gets worse. We saw that with COVID-19 as well, but the studies of how that's going to impact the brain afterwards is still ongoing. But a lot of people with dementia as well are at a higher risk because, you can tell them to wash their hands, but they may not know what you just said or how to do that anymore. So it really takes a toll on the caregiver to get them to the sink, do the 20 seconds it takes, really try and get them to wear a mask when they don't understand why. Things like that kind of make it a little more difficult for that caregiver at home. So we're going to go, these are on alz.org, and they are COVID-19 tips and topic sheets. We're going to go through some of them as we go on here. So I'm not going to go over that with you guys, but you can definitely pull it up and read it on your own time. But we are going to go through a couple of them now. So tips for caregivers at home. You want to follow CDC guidelines and consider the following, right? They need to support to remember the hygienic practices. Consider placing signs to wash your hands for 20 seconds or sing happy birthday, things like that. Demonstrate, show me how you used to have your kids wash your hands. We use that a lot. And if all fails, hand sanitizer can be an alternative, right? But a lot of times they don't understand why you're asking to do this. And if they don't understand why you're asking them to do something, they're going to say no. I don't need to do that, or I already have done that, things like that. So we have to really get clever on how to get them to maintain hygienically. So if you notice at home that you have a rapid increase of confusion, right? You're talking to your doctor. This is like the Alzheimer's disease is a slow progression, which we all know. So if you see an acute change in behavior or change in condition of any type, you should be talking to your doctor anyway. But especially now, being that we are under COVID-19, right? So it's important that if you see any kind of changes, that you are talking to your doctor. And it's important to request prescriptions is a great idea to get it extended out, so you're making less trips to the pharmacy, right? Things like that. You're gonna, you might have to make alternative plans of adult daycare and respite. So these are the things that have changed the world for those caregivers. Because not only are they not getting that respite because adult day cares may have closed down, they are having to establish a new routine in the house 24/7, right? So it's very important that you talk to that adult day program, ask what the routine was, try and emulate it at home as best as you can, so that break is not as severe. And then you develop your plan at home. But if you know that every day at the day center they had exercise at 10, you can absolutely sit in the living room, make that your daily routine, right? And it's important that caregivers make alternative plans if primary caregivers go down. And this is in general, right? Before COVID-19, a lot of caregivers, they don't think of themselves at all, right? So, if you ask them what happens if you have a heart attack, what's the plan? They look at you like, I have no plan. So it's important that caregivers put into place that if one of them gets sick with COVID-19 and has to isolate, what does that look like? Who are they going to call on? Have that plan ready, because this doesn't, it can happen in a heartbeat, right? So you want to make sure that alternative plans are made in case you have to go to the hospital. Who's going to look after the loved one at home? Things like that are very, very important for caregivers to think about. And what else that I think is good that came out of COVID-19, if you want to think of things that are good that have come out of it, is that we now have delivery from grocery stores, which before COVID-19, a person with dementia and their loved one would go to the store, and it's extremely stressful for caregivers because they have to watch their loved one at the same time as try and get their thoughts together on what they need. The other one is telemedicine. Doctors are doing more and more televisits kind of thing. So what happens is before COVID-19, a caregiver would skip their doctor's appointment because it's too hard to have their loved one in the waiting room and something goes on, that kind of thing. Now they can actually have their visits at home through a computer, which is something that I hope continues for the caregiver's sake that are caring for their loved ones at home. All right, so tips for caregivers using home-based services. It's important to ask the provider to explain their protocols, right, to reduce the spread. You want to make sure you're taking the temperatures of the people who are coming in to visit your loved one. Anywhere from 104, they shouldn't be let in. You want to be asking them if they have any of the symptoms, if they've been around anybody with COVID-19. If they've been exposed, if the worker has been exposed to anyone who has tested positive, all those things are important because you don't want to allow them in your home until they're for sure negative. Ensure the healthcare professional washes their hands, have that place for them to go, make sure they're wearing their mask or the proper PPE. Be aware that bringing anyone into your home increases the risk of COVID-19, right? They may not be showing any symptoms that day, but the next day they do. So it's important that you follow the CDC guidelines. It's not going to be perfect. You're not going to catch everybody who comes into the home when you need home-based services. But, you're going to try to do your best to mitigate that through the questions you're asking and the temperatures you're taking and those sorts of things. Okay. Very important. So tips for caregivers of individuals in residential care. This has been very, very difficult for family members, being that they are told they cannot come in, right? At the very beginning of this, it was very difficult. And we, like I said, we carried that weight for them. We made sure that we connected them in certain ways. So you want to check with your administration regarding procedures managing COVID-19. In our community, I mean, you're cleaning high touch areas all the time. We're wearing our masks. We're trying to reduce any kind of spread, right? Because if anyone's going to bring it in, it's going to be the staff or outside people. So we want to make sure that we're protecting them because they're no longer going out, right? So you want to make sure that the administration has multiple emergency contacts numbers for you. You don't want to be visiting if you have any symptoms whatsoever. Even if you suspect anything, it's better to be safe than sorry and not visit. And if you're unable to visit due to illness or lockdown, ask staff how to maintain contact, right? So we can telephone calls, we can do FaceTiming. At the very beginning of this, it was very difficult because people with dementia didn't understand FaceTime. So they would see the picture of their loved one and go, I want to get in there. I want to get in there. I want to get in there. Why can't I get in there? And so for us, we didn't have an option, right, to not let this go. We needed to make sure that they got more and more comfortable. So we continued to do it until they got the hang of it through habitual action, right? So we did it all the time so that when they did see them, their faces started to light up and they kind of got a grip of what was going on. So it's important that the facilities or the communities have that connection with you to your loved one, being that you're not able to visit. So residential care incidents considerations, right? When you're maintaining the person in the residential care, you can ask the administrator what the quarantine procedures are. Quarantine is very different from isolation. Quarantine, you may be able to go out in the courtyard, take a walk, and come back as long as you don't have any contact or are anywhere near a resident, right? Isolation is very different, and that's where technically we have to, if the person is someone who wanders, we do a one-on-one on them because they have to stay in their room because they are infected. You want to know what is the level of confidence in the CDC guidelines are being followed. What do you guys do every day? We temp people in all day, every day. We have gone to the extent of COVID-19 testing, Binex cards, things like that. You can ask all of these questions on how many people are in the building, have been impacted, staff, residents, both. We have family Zooms once a week that we let everybody know, and you'll get letters, and you'll get, if there is a COVID positive. Is your family member able to follow social distancing, right? In our community, I actually went and took the couches out and strategically placed furniture 6 feet apart, because there's nothing worse than trying to have to tell a person with dementia they can't sit next to their friend and they don't understand why you're trying to separate them, and they don't get it. This way I've eliminated that trigger, and it works really well. Does the resident have personal protective equipment? Is the PPE there? Are the masks being used? How many staff members interact with your family? All of these things are really good questions for the community that your loved one lives at, and they should be very, very, very transparent. So hopefully when you do call and ask these questions, they are being transparent with you, because they're very normal, regular questions that you should be asking. If you're choosing, say there's an outbreak and you're nervous and you want to move your loved one to another location, right? There's no way to know whether that residence will remain free of COVID cases. We had a resident who had to move because of financials, and the day before she was supposed to move into her new community, they had an outbreak. And so she was rerouted to a different community, a sister community of theirs. You will never know if she had landed there and then a day later they could have had an outbreak, right? So, you want to know if they're accepting new residents. You want to, have there been any COVID cases in the new location? You're within your right to ask all of those things. And ask many of the same questions that we did on the previous slide, and you will be fine. So if you're considering moving someone home from a community, and this has crossed the minds of almost every family member I can imagine, because when you are told you cannot go in and touch your loved one, the one thing you want to do in life is to hold them and hug them. So a lot of people were considering moving them home. If you are going to do that, you have to ask yourself these questions. You have to ask, what level of care does the person need day to day, and be realistic with that. So it's talking with the facility, the community that they live in. Is your family able to provide that level of care, right? Assess the number of people who provide adequate care, while also limiting the number of people who are coming into your house, right? So you want to make sure the family members that are coming in, are they showing symptoms? Who works outside the home that may be coming in and where they've been. And then, will you need to hire some home care workers? Again, we'll be bringing in, you want to make sure you're following the CDC guidelines if that happens, but hiring home care workers as well is very expensive. So you want to do your research and things like that if there is that need to bring them home, to make sure that you are following the CDC guidelines. There's not going to be this disease it doesn't matter where you go, right? We're finding that, it's all around us right now, and we're trying to protect the most vulnerable in the best way we can. So it's important to know that nothing's going to be 100% proof. So activities at home, create a simple plan. It's very important for people who are living at home to, have a schedule and a routine. Unfortunately, when we used to go have our coffees at McDonald's every Monday, Wednesday, and Friday, it can no longer happen. But maybe we will have a little coffee hour out in the patio instead on those certain times, right? Or we're going to go to a ride, go through the drive-thru, pick it up, and go to the park. Keep skills and abilities in mind. You want them to help you do things, but don't make it too hard and don't make it too easy, because if it's easy, people are going to say that I know what I'm doing. Or then if it's too hard, they're just going to shut down on you or yell at you. They're going to say, I know what I'm doing. And that can get very frustrating for them and for the caregiver. So make sure that you're using the skills that they have left. Focus on enjoyment, not achievement. So if they've set the table wrong, you say, thank you so much. Why don't you go watch TV? I'm so grateful you helped me. And then you fix it behind them. You don't want to go in and tell them they did it wrong. And be mindful of exposure to upsetting content. Because a lot of times, when people are watching the news or TV shows, they can take that as reality. Well, the news is reality, but like some of the TV shows, if there's a Western on and the guy is shooting at someone else, they may think that's happening at this very time. So be mindful of what they're watching on TV. Musicals are better, things like that. But it's good to go for walks. You can do scrapbooking. You could take this time to garden and, get your hands in the dirt and learn something new with them. And music is so underutilized, but music and dancing is what we have used in the communities a lot during this time because it's good for the soul. So we will have dance parties a lot. We'll have dance parties, in-room engagement. We will be using music quite a bit because it does help the morale and the mental state of our residents. Okay, so caregiver stress is a real thing, especially with people who are caring for loved ones with dementia. We do 8-hour shifts for a reason. There's not a whole lot of doubles going on because you can get exhausted and then you become short. So it's important that we understand the symptoms of caregiver stress. If we see anger, social withdrawal, anxiety, depression, exhaustion, sleeplessness, all of this are some of the symptoms. But ways to combat that, we find that physical activity is fantastic for that. Going for a short walk, breathing, exercises, meditation. You want to stay connected with your family, having little, Zoom parties or, getting the grandkids on FaceTime and playing war with them with a card game. This is a time where we have to get clever to try and connect with people when we're not allowed to connect with people, right? Because we might get sick. So finding ways to get support. The Alzheimer's Association has amazing support groups out there that you meet with, that you can kind of diffuse and get your stress out and then go in for another month. That those are so beneficial because people are in it, the same situation you are, and they give each other amazing advice. I was a support group leader, and I did a lot of listening, where I'd been in this business for a long time, but I didn't have to fix their problems for them. The people who were joining the group would give each other advice left and right, and I would be amazed at how these caregivers handle situations. So it was really, really cool to watch, and those are very much useful. So we will talk about some of those resources after this. And so I want to go over some of the resources that the Alzheimer's Association has. We have a 24/7 helpline, and you're going to get master's level clinicians on those calls any time of day. So it's important to phone them, even if it's in the middle of the night and your loved one thinks he has to go to the bank, right? And he's walking out the door. Please give them a call. Or if you just need resources during the day and where you want to find groups and things like that, it's very important. It's all confidential, and it's a free service. So please look into the 24/7 helpline, 1-800-272-3900. And we do have an interpreter on that line as well if we need many different languages. So there shouldn't be a barrier there. Our virtual programs, 10 warning signs, understanding Alzheimer's, all of these that we used to present in person are now online. So you don't even have to leave your home, and you can stay in your pajamas and listen to the information that is provided. It's at www.alz.org. The Community Resource Finder is a great tool for looking up care at home, or if you need medical services, housing options, programs and events that are happening, community services. All those resources are here at your fingertips, and you just punch in your zip code and it will take you where you need to be. AlzConnect is more of a forum where you can speak with other people. They have it for teens. They have people living with the disease. We have caregivers, family members, secondary caregivers, those people that are caring for them far away. They can all get online and discuss what's going on. You can do a profile, or you don't have to. You can just listen. So it's a good resource to have. Also grief support, which is cool, because if you get in that one where you've lost that person with dementia, the grieving process is a little bit different, because we've been grieving with every loss they've had, right? We've been mourning that loss as we go along. So it's really cool to be in a specific Alzheimer's group like that. The Navigator is like online tools. It's a great guide for caregivers to answer, by creating a personal action plan and linking information. So you can do your profile, and you can pick and choose what you want to learn about and what's important to you as a caregiver, because everybody's different. So this is a great way and a great tool to put all that together so you have it in one place. And that's it. If anybody has any questions.
My apologies, I couldn't get myself off of mute. They were asking about the slides being available after the presentation, and I just want to let everybody know that we will definitely be sending out a follow-up that has links to some of the important information that everyone has heard today, so that you'll be able to access that after the event today as well. And I think that is all of the questions that we had, Denise. So thank you so much, and thank you to everyone for being here today. And I do want to just give a final thank you to the UT Dell Medical School for partnering with us today to bring this event to you. And we hope that you've all enjoyed the information and have a great rest of your day. Thank you all so much.
Thank you.
Bye.
Thanks everyone for participating. Appreciate it. The first person to survive Alzheimer's disease is out there. They're going to hold on to everything the disease steals away. That smile they can't hide. That dance class they love. Every single piece of them is going to make it through. And the Alzheimer's Association is going to make it happen by funding research, advancing public policy, and spurring scientific breakthroughs. And by providing local support to those living with the disease and their caregivers, we're easing the burden for all those facing it until we accomplish our goal. Alzheimer's disease has devastated millions of lives, but that's all going to change when we reach the first survivor. But we won't get there without you. Visit alz.org to join the fight.